the signs and symptoms of hypertension. How do you identify hypertension? Hypertension does not usually, cause obvious symptoms. That is why it is always referred to as a silent killer, because if the blood pressure is not measured, in many instances, the person may not be able to know or identify that he or she has high blood pressure. That's why it is called silent killer. It kills silently because until fatal situations occur, that is when the individual is identified to be hypertensive. Symptoms are usually felt when there is a crisis. And this happens when the blood pressure suddenly just spikes up to anything above 180 millimeter of mercury for systolic and above 120 millimeter of mercury for the diastolic pressure. So when this occurs, there could be some symptoms or signs that could come with this kind of measurement. Any measurement above 180 millimeter of mercury for systolic and 120 millimeter of mercury for diastolic. So out of these ones, there may be sudden vision changes, there may be back ache, there may be abdominal pain, there may be chest pain, nose bleeds. In some instances, you will see that the individual is bleeding from the nose. There may even be difficulty talking. The person finds it difficult to talk. At that point, it may be as a result of high blood pressure. There may be general body weakness, severe anxiety. The person is feeling so anxious. There could be numbness of the extremities, fingers, or the toes. There may be shortness of breath. The person finds it difficult to breathe normally. There may be headache, severe headache. When there is severe headache, check your blood pressure, especially when it is sudden. All these are signs of increase in blood pressure.